Welcome everyone to this Privacy Rules, Privacy Espresso. Today I'm joined by Magdalena Kogut Charkowska from the law firm Timelex based in Belgium. And we are going to discuss together about health data space. Hello, Magdalena.
Hello, hi, nice to see you.
Thanks for being with us and thanks for touching together with us this very interesting topic. And I know that you have been also writing about this. So we will also link the article to this video, but let's have an overview on what this is. So what's European Health Data Space, first of all?
So European Health Data Space is a proposal of an EU regulation. So we are still at the proposal stage, and the overarching aim and ambition of this proposal is to regulate the use of electronic health data. So by electronic health data, we mean not only personal data as in GDPR, but broader. So any information that is related to the treatment of the patient, even if it's about providing the services to the patient, or if it's information that is derived from the data of the patient, so like diagnosis or inferred. So really quite a broad approach. And this regulation is supposed to help with a number of areas. So the first area that it's going to touch upon is the rights of the individuals, so the patients, to better control their data and to use it for their advantage, or to have a better overview how their data is used in the healthcare context. Then the second part of the regulation is about enabling researchers and policymakers to access the data for their purposes, to benefit the society as a whole. So the pandemic of COVID-19 has showed that this fragmentation of laws about accessing health data is really hindering the governments to stop this pandemic, but also sort of emphasized a discussion that was going on for many years prior about the obstacles for reusing health data for innovation purposes, to develop personalized medicine, to develop new therapies, new medicine. To do all that, you really need access to the data. And this data is held by different institutions. They are very worried about giving too broad of access to that. There are fragmented rules in different member state countries. So this is an area that this European Health Data Space regulation is supposed to help with. These two areas, so the first one about taking care of the patient is called the primary use of data. And then we have the secondary use of data. That's the second pillar. This is the second area that I was talking about.
Perfect, Magdalena. Thanks for this overview. And you were speaking about the first pillar, in particular about individuals and patients. So which are the changes that the European Health Data Space will bring to patients?
So those changes will be about strengthening the rights of the patients to control their data. And to understand these rights, well, you might say, well, we have GDPR in place, we have general data protection rules, but these rules were put in place for all types of personal data context. So they are not specific to the context of healthcare. So, for example, the proposal is one of the rights that will be given to the patients under the proposal is the right to access patients' data immediately in a way that is free of charge, in a readable and understandable format. And there is a similar right under GDPR, but this right gives the patient the right to request this access, but then the controller has a month to respond, which is you need to access your data right now, isn't that helpful? So the proposal is building on a framework that is already there, the GDPR framework, but it's going further. So that is one example, the access data in a more efficient way. But another example is to allow these patients to take their health information, for example, about their prescriptions, about the results of their tests, discharges from the hospital, so the most essential health information, and to make it available to another doctor even in another EU country. So this would be relevant for those of us that travel within EU or work in another country. There is right now, it's again very fragmented. There is a challenge for someone to be able to share their information, their medical information, with another doctor in another country. And that is again something that the European health data space can help to address. Another example would be that the patient could control what kind of information their doctor will be able to access. So let's say your electronic health record has all the information about the different therapies and the different specialists you've been seeking, and you might want to restrict the access to all of this information because you feel some of it might be too private, or you don't necessarily want to share this with anyone. So that is another control that the European health data space might put in place. Of course, there are some rules that will have to be worked out in details, because sometimes if a patient would choose to hold back some information, that may impact their treatment, but that is precisely the kind of details that the European health data space will take care of.
Okay, well, speaking about companies and research communities, how will companies and research communities benefit from the European health data space?
So that's the second pillar that we would be talking about. So the secondary use of data, and it's very difficult for the researchers to get access to quality data sets, and especially research in the area of AI and personalized medicine requires good quality information to be analyzed and to be processed to train the AI models, for example. And without access to this data, these developments cannot go forward. The European health data space will put in place a framework and some ground rules on how the access to health data for these secondary purposes will work in practice. So the most important rule is that the data holders, so the entities that have this data, will be obligated to make this data available to researchers if those researchers apply for so-called data permit. And the data permit system is going to balance the rights for the researchers against the rights of the patients, because the researchers will have to, on one hand, explain why they need the data, why their research is beneficial for the community and for the society as a whole, while this information will be either pseudonymized or anonymized, and it will be provided in a secure environment. So there will be safeguards for who right now might be concerned that making their data available to researchers might put them at risk. So at the center of this system, there will be health data access bodies, so authorities that will issue these permits to the researchers and will make the data available through the secure processing environments, so that this concern for patient safety is also addressed. That is, I would say, one of the biggest benefits for the research community in the context of European health space. There are some other benefits for companies as well. So for example, standardization of the electronic health record systems in which the data is kept. That is something that is also important, that these systems are interoperable with one another, and that systems that are deployed in one country in the European Union can communicate with a system that is in another country. Without that, this whole framework would not work. So it's about standardization as well as giving access to data.
Perfect, Magdalena. Thank you very much for this brief overview on this topic. It was a pleasure being with you. We're ending up our time. So thank you very much for being with us for this Privacy Espresso. And of course, I would like to thank all our listeners for being with us today and to invite them to contact Magdalena if they need any support under the perspective of the European health data space and in general, privacy and data protection, as she is an expert in the topic. So Magdalena, I hope to see you and our listeners very soon again. Bye, everyone.
Thank you, Alessandro. Bye-bye.